There's a number hiding on every blood pressure reading you've ever had that could kill you. Two numbers, one on top, one on bottom. You've seen them 1,000 times. 140 over 85, 128 over 78. Your doctor rattles them off at every visit, but here's what nobody has told you clearly. One of these numbers is dramatically more dangerous than the other after age 60. And the number that's silently destroying seniors' brains, hearts, and kidneys might not be the one you're watching. Research from the Framingham Heart Study following over 5,000 people for decades proved this conclusively. One number predicts heart attack and stroke risk 2 to 3 times more accurately than the other in older adults. I'm Dr. Curtis P. Langlotz, and after 28 years as a cardiologist, I've seen what happens when people focus on the wrong number. I've held the hands of stroke victims who thought they were fine because half their reading looked good. I've watched families torn apart because a doctor celebrated the wrong measurement while danger was building silently. By the end of this video, you'll know exactly which number is trying to kill you. You'll understand why this changes after 60, and you'll know precisely what to do about it starting today. But I'm not telling you which number yet, because if I just say it, you'll assume you already know. You'll think, obviously it's the top one, or obviously it's the bottom one, and you'll leave. But you need to understand why your age changes everything. You need to see what happens when someone watches the wrong number. Stay with me. This could be the most important 15 minutes you spend this year. Comment your most recent blood pressure reading right now. Both numbers, I want to see what we're working with. First, let me make sure you truly understand what these two numbers represent, because most people don't. When that cuff squeezes your arm, it's measuring the force of blood pushing against your artery walls. But blood pressure isn't constant, it pulses with every heartbeat. That's why you get two numbers. The top number is systolic pressure. This is the peak pressure, the maximum force when your heart contracts and pushes blood out. Think of it like a wave crashing against a seawall. That's the moment of highest pressure. The bottom number is diastolic pressure. This is the minimum pressure between heartbeats when your heart relaxes. It's the calm between the waves. So when your reading says 145 over 82, it means your peak pressure is 145 millimeters of mercury, and your resting pressure is 82. For decades, doctors treated both numbers equally. If either one was high, you had hypertension. You needed treatment. But as researchers followed millions of people over decades, tracking who had heart attacks, who had strokes, who died from cardiovascular disease, a pattern emerged, and this pattern becomes dramatically more important after age 60. Let me tell you about Evelyn. Evelyn was 71 years old when she came to see me for a second opinion. Sharp, energetic, still working part-time as a bookkeeper. Her blood pressure that day was 162 over 68. She was relieved when she saw the reading. "Dr. Langlotz," she said, "my bottom number is excellent. It's been under 70 for years. My regular doctor says as long as that stays low, the top number isn't as concerning. He said my heart is relaxing beautifully between beats." I felt my stomach drop. "Evelyn," I said carefully, "who told you the bottom number was the important one?" "My doctor. He's been saying it for years. He says diastolic pressure shows how hard your heart is working all the time. Mine is perfect. So I'm protected." I tried to explain. I showed her the research. I told her that at 71, her systolic pressure of 162 was dangerous, that it needed treatment, that the diastolic of 68 didn't protect her from anything. Evelyn didn't want to hear it. She trusted her regular doctor. She'd been with him for 15 years. "He knows my body," she said. "He wouldn't steer me wrong." 4 months later, Evelyn had a massive stroke. I got the call from her daughter. Evelyn had collapsed in her kitchen. By the time paramedics arrived, the left side of her face was drooping. She couldn't speak. She couldn't move her right arm or leg. The stroke was caused by years of elevated systolic pressure pounding the delicate blood vessels in her brain. Tiny injuries day after day, year after year, until one vessel finally ruptured. That systolic pressure of 162, it had been silently destroying her brain while everyone celebrated her perfect diastolic number. Evelyn survived, but she wasn't Evelyn anymore. She spent 3 weeks in the hospital, then 6 weeks in rehabilitation. She never regained full use of her right side, never returned to work, couldn't write anymore, couldn't do the bookkeeping she'd loved for 40 years. Her daughter moved her into an assisted living facility because Evelyn couldn't live alone, couldn't cook, couldn't bathe safely, couldn't be trusted not to fall. The vibrant, independent woman who'd walked into my office was gone, replaced by someone who needed help with everything. Her daughter called me a month after Evelyn moved into the facility. "She cries every day," she told me. "She says she wishes she'd died instead. She says this isn't living. Then she asks the question that haunts me. Why didn't anyone tell her the top number was the dangerous one? Why did her doctor keep saying she was fine? Comment top if you've been told to focus on your systolic pressure. Comment bottom if you've been told diastolic is more important. I need to see what information is being given out there. Now let me tell you about Gerald, because his story shows the opposite problem. Gerald was 67 years old. His reading was 124 over 94. He was terrified. Dr. Langlotz, he said, my bottom number has been creeping up for years. I read that high diastolic means my heart never gets to rest. It's working too hard all the time. I'm convinced I'm going to have a heart attack. Gerald had been losing sleep over this. He'd bought 3 different blood pressure monitors. He checked his pressure 5 times a day. He was anxious, stressed, which was probably making his readings worse. I ran a complete workup. Stress test, echocardiogram, coronary calcium score. Gerald's heart was fine. His arteries were clean. His risk was modest, nowhere near the emergency he feared. Yes, we needed to address that diastolic of 94. It shouldn't be ignored. But Gerald's terror was misplaced. His systolic of 124? That was actually excellent for his age, protective. The real danger sign would have been if that top number was 160 or 170. Gerald had been so fixated on the bottom number that he hadn't realized his top number was actually good news. 2 patients, both over 60. One focused on the wrong number and had a devastating stroke. One worried about the wrong number and lost years of peace of mind to needless anxiety. Both were missing the same critical piece of information. So which number is actually dangerous after 60? Before I tell you, you need to understand why your age changes everything, because the answer isn't the same for a 35-year-old as it is for a 70-year-old. Your blood vessels change as you age, and this change is the key to understanding which number will predict whether you live or die. Your arteries are not rigid pipes. When you're young, they're flexible tubes, elastic like rubber bands. When your heart pumps blood, healthy young arteries expand to absorb that pressure wave. Then they recoil, squeezing the blood forward. This elasticity serves a crucial function. It smooths out the pressure, protecting your organs from the constant pounding of each heartbeat. In a young person with flexible arteries, the systolic pressure stays relatively moderate because the arteries stretch, and the diastolic pressure stays relatively high because the arteries recoil. But here's what happens as you age. Starting around 50, your arteries begin to stiffen. The elastic fibers in the artery walls break down. They're replaced by stiffer collagen. Calcium deposits form. Plaques develop. Your arteries become less like rubber bands and more like rigid plastic tubes. By age 70, your arteries might be 50% stiffer than they were at 40. Now, when your heart pumps blood into these stiff arteries, they can't expand and absorb the pressure. The systolic pressure shoots up, and that wave has nowhere to go. But during the resting phase, those stiff arteries don't recoil effectively. The diastolic pressure often stays normal or even drops. This is why you see so many older adults with readings like 165 over 72 or 158 over 68, high systolic, normal, or low diastolic. This pattern has a name, isolated systolic hypertension. It's the most common form of high blood pressure in people over 60. For years, doctors weren't sure what to do about it. Some thought, well, if diastolic is fine, maybe this isn't really hypertension. Maybe this is just normal aging. We now know that thinking was catastrophically wrong. That elevated systolic pressure isn't a harmless marker of stiff arteries. It's actively destroying your organs. Every single heartbeat, that high systolic pressure is hammering your blood vessels, your brain, your kidneys, your heart, your eyes. Think about it. 60 to 80 beats per minute, 3,600 to 4,800 beats per hour, over 100,000 beats per day, millions of beats per year. Each one delivering that elevated pressure, each one causing microscopic damage, each one pushing you closer to stroke, heart attack, kidney failure, dementia. So let me be absolutely clear. If you are over 60 years old, your systolic blood pressure, the top number, is the more dangerous number. This is the number that's most likely to predict whether you'll have a heart attack or stroke. This is the number that research shows is 2 to 3 times more predictive of cardiovascular death than diastolic pressure in older adults. This is the number you need to be watching. The Framingham Heart Study proved it. The MR-FIT study tracking 300,000 men confirmed it. Study after study after study points to the same conclusion. After age 60, systolic pressure is what's trying to kill you, not diastolic, systolic, the top number, the peak pressure, the one that spikes with every heartbeat and pounds your organs relentlessly. Evelyn's doctor got it backwards. He celebrated her diastolic of 68 while her systolic of 162 was destroying her brain. And she paid the price. Comment, I didn't know if this information is new to you. Comment, I knew if you already understood that systolic matters more after 60. I want to see how many people have gotten correct information. Now let me show you exactly what elevated systolic pressure does to your body. Because when you understand the damage, you'll never ignore that top number again. Your brain is the most vulnerable. The small blood vessels feeding your brain tissue cannot handle chronic high pressure. They develop microaneurysms, tiny weak spots that can rupture and cause hemorrhagic stroke, or they become narrowed and blocked, causing ischemic stroke. But here's what most people don't realize. Even if you never have a major stroke, chronic high systolic pressure causes thousands of tiny silent strokes. Microscopic areas of brain tissue die. You don't feel them happening. Over time, this leads to vascular dementia, memory loss, confusion, difficulty thinking, personality changes. Many cases of what families call just getting old, or even Alzheimer's, are actually vascular dementia from years of uncontrolled systolic pressure. The brain was being killed by blood pressure, and nobody knew. Your heart suffers too. To push blood into stiff, high-pressure arteries, your heart muscle has to generate enormous force. Over time, the muscle thickens trying to keep up. This thickening is called left ventricular hypertrophy. A thickened heart is a stiffer heart. It doesn't fill properly. It doesn't pump efficiently. This is how heart failure develops, not from a single dramatic heart attack, but from years of your heart fighting against elevated systolic pressure. Your kidneys are being destroyed. Your kidneys contain millions of tiny filtering units, each supplied by delicate blood vessels. Elevated systolic pressure damages these vessels progressively. Once kidney function starts declining, your kidneys can't regulate blood pressure properly anymore, which makes the hypertension worse, which damages the kidneys more. A vicious cycle that can end in dialysis. And here's the cruel irony about diastolic. While high systolic is the primary danger, very low diastolic in older adults creates its own problem. Your coronary arteries, the vessels feeding your heart muscle, fill primarily during the resting phase between heartbeats. If diastolic drops too low, below 60 or especially below 50, your heart might not get adequate blood flow. This is why some older adults have chest pain and even heart attacks, despite having clean coronary arteries. It's called demand ischemia. The heart isn't getting enough blood during diastole. So the ideal situation is not sky-high systolic with rock-bottom diastolic. The ideal is both numbers controlled appropriately. But if we had to prioritize, if we could only control one number, the evidence is overwhelming. Control systolic. It's the killer. Let me tell you about Arthur, because his story shows what happens when you get this right. Arthur was 74 years old. His blood pressure had been running 168 over 76 for years. His previous doctor had focused on the diastolic, which looked fine. Nobody treated the systolic aggressively. Arthur came to me after his brother had a stroke, scared him into getting a second opinion. I explained the research. I told him his systolic of 168 was a ticking time bomb, that every day it stayed elevated, his risk of stroke increased. But my bottom number is perfect, he said. Your bottom number is irrelevant, I told him. At 74, your top number is what's going to determine whether you have a stroke or not. We need to bring it down. We started treatment. Lifestyle changes first. Sodium restriction, weight loss, daily walking. Then medication when lifestyle alone wasn't enough. Over 4 months, Arthur's systolic came down from 168 to 134. His diastolic stayed around 72. Both numbers now in a safe range. That was 6 years ago. Arthur is now 80, still living independently, still sharp, still walking 2 miles every morning. No stroke, no heart attack, no kidney problems. His brother, the one who had the stroke, is in a nursing home. Can't walk, can't feed himself. 2 brothers, similar genetics, completely different outcomes. The difference? Arthur found out which number mattered and took action. His brother didn't. Arthur tells me every visit, "You saved my life by telling me the truth about that top number. Nobody else would say it that clearly." Comment your age and your most recent systolic number, just the top number. Like this, 72, systolic 148, or 65, systolic 128. I want to see where people are at. Now let me give you exactly what to do with this information. Step 1, know your systolic number, not your blood pressure from 6 months ago at a doctor's visit. Your current systolic measured at home multiple times. Buy a validated home blood pressure monitor. They're inexpensive and available everywhere. Check your pressure morning and evening for a week. Write down every reading. Calculate your average systolic. This is your true baseline. Office readings can be artificially high from white coat syndrome or artificially low from rushing. Home readings give you reality. Step 2. Know your targets. Current guidelines from the American Heart Association. For most adults over 65, the target is systolic below 130. For very healthy older adults, some evidence suggests below 120 is even better. For frail elderly or those over 80 with multiple health conditions, targets of 130 to 140 may be more appropriate to avoid complications from overtreatment. If your average systolic is above 130, especially if it's above 140, you need to take action. Step 3. Implement lifestyle changes. These can lower systolic by 10 to 20 points in some people. Sodium restriction. Cut to under 2,000 milliliter daily. This alone can drop systolic by 5 to 10 points. Weight loss. Every 2 pounds you lose, drop systolic by about 1 point. Lose 20 pounds, drop 10 points. Exercise. 30 minutes of moderate aerobic activity most days. Walking counts. This improves arterial flexibility over time. Limit alcohol. More than 2 drinks daily significantly raises systolic. Stress management. Chronic stress elevates blood pressure constantly. Meditation, deep breathing, whatever works for you. Step 4. Talk to your doctor about medication if needed. For most people over 60 with systolic above 140 or 150, lifestyle alone won't be enough. Medication is usually necessary. This is not a failure. For stiff, aging arteries, medication is often life-saving. Many people need 2 or 3 medications to control systolic adequately. This is normal. This is not excessive. If one medication causes side effects, tell your doctor. Don't just stop taking it. There are many options. Almost everyone can find a combination that works. Step 5. Monitor consistently. Check your blood pressure at home at least weekly once you're stable. Keep a log. Bring it to every doctor's appointment. Your needs will change over time. Kidney function changes. Other medications get added. Blood pressure control requires ongoing attention, not a set-it-and-forget-it approach. Step 6. Never stop medication suddenly. If you're concerned about your blood pressure medication, talk to your doctor. Stopping abruptly can cause dangerous rebound spikes. Adjust together. Never go rogue. Let me address the objections I hear constantly. My father lived to 88 with high blood pressure and never took medication. Survivorship bias. For every person who beats the odds, many more died from stroke or heart attack in their 60s or 70s. You don't hear their stories because they're not here to tell them. The data is clear. Treating elevated systolic pressure prevents strokes and heart attacks. Don't gamble your life on being the lucky exception. I feel fine. Why treat something with no symptoms? Because by the time high blood pressure causes symptoms, catastrophic damage has already occurred. The stroke happens suddenly. The heart attack strikes without warning. This is why hypertension is called the silent killer. It works quietly for years, destroying your arteries, weakening your organs, setting the stage for disaster. Waiting for symptoms is waiting too long. Blood pressure naturally rises with age. We shouldn't fight it. Blood pressure rises with age because arteries stiffen. But just because something is common doesn't mean it's harmless. The HEVET trial specifically studied treatment in people over 80. Results: stroke reduced by 30%, death from any cause reduced by 21%. Treating blood pressure in older adults protects them. The key is doing it carefully with proper monitoring. Lowering blood pressure too much causes falls and confusion. This can happen if treatment is too aggressive, especially in frail elderly patients. That's why individualization matters. But for the vast majority of people over 60, blood pressure control is enormously beneficial. The risk of not treating far exceeds the risk of treating appropriately. I think about Evelyn often. I think about her sitting in that assisted living facility, crying every day, wishing she had died instead of living like this. I think about her daughter's question. Why didn't anyone tell her the top number was the dangerous one? I think about how easily it could have been prevented. If someone had clearly explained that at 71, her systolic of 162 was the threat. If someone had insisted on treatment instead of celebrating her diastolic. Evelyn had decades of good life stolen from her because she watched the wrong number. Her doctor gave her bad information. The medical system failed her. And she paid with her independence, her dignity, and eventually her will to live. I can't go back and save Evelyn, but I can make sure her story saves others. I can make sure you know what she didn't know. That's why I made this video. You now know the truth. After age 60, your systolic blood pressure, that top number, is the dangerous one. It's the one that predicts stroke, heart attack, heart failure, kidney disease, dementia. It's the one that needs to be controlled. Don't make Evelyn's mistake. Don't celebrate a good diastolic number while your systolic is destroying your organs. Know your numbers, focus on systolic. Take action if it's elevated. Work with your doctor to bring it under control. This information is power, but only if you use it. If this video gave you knowledge that could save your life, share it. Think about everyone you know over 60, your spouse, your parents, your siblings, your friends. How many of them are walking around right now with elevated systolic pressure, thinking they're fine because their diastolic looks good? How many of them are one stroke away from losing everything? Share this video. It could literally save someone's life. Subscribe to this channel. I'm committed to bringing you clear, research-based information that cuts through the confusion. Information your doctor might not have time to explain. Information that could change your future. And leave a comment. Tell me your story. Were you surprised to learn that systolic matters more after 60? Have you been focusing on the wrong number? What questions do you still have? I read every comment. Your questions help me create content that serves you better. Your heart has been beating faithfully for over 60 years, over 2 billion beats. It deserves your attention and care. Controlling your systolic pressure is one of the most important things you can do to protect it. Don't let that top number sneak up on you. Watch it, control it, live. I'll see you in the next video.